Everyone at some point in their life has had an experience in a hospital. And almost every time we're in the care of a healthcare professional, there is a wait. Most of the time, we jump to conclusions, saying the nurse is just taking their sweet time. Have you ever stopped to think that they have more work than they can handle? There's a shortage of all healthcare professionals throughout the United States. One shortage in particular that we should all be very concerned about is the shortage in registered nurses. The current estimate is a deficit of nearly 1 million nurses by the year 2022. Nursing shortages are nothing new for our country. However, we have never seen one like this. Our nursing shortage is caused by an aging population, an aging workforce, and a shortage in the education field. Registered nurses represent the largest healthcare professionals in our country. A registered nurse is an important healthcare professional that has earned an associate's degree or bachelor's degree and has some of the biggest responsibility in providing direct patient care. Although registered nurses represent the largest healthcare profession, the numbers of nurses coming into the field is far less than the numbers retiring from the field. The nursing shortage is greatly affected by the aging population, aging workforce, and the wait list in nursing programs. This shortage might be moving more towards a crisis. As our population ages, so does the need for new nurses. At least 80% of our elderly population have at least one chronic illness such as diabetes, arthritis, asthma, depression, Alzheimer's, or hypertension. 68% of the population has at least two of these chronic illnesses. Yet with medical advancements, these people are living longer than their parents did. Many nurses that currently care for these people decided to stay in the nursing profession longer because of the recent recession. Approximately 1 million nurses are over the age of 50. This means about 1/3 of the 2.7 million nurses in the field will reach retirement age within the next 10 to 15 years. With that many nurses exiting the field, why are people not going into nursing school? There is a strong link between a bachelor's degree in nursing and better patient outcomes. Because of this, many hospitals will only hire nurses with their bachelor's degree or associate's degree that are willing to go back and get their bachelor's. Even though the market demand for more educated nurses, nursing schools are turning away thousands of qualified applicants, 68,000 of them in 2014 alone. Because there is a shortage in the nursing field, there is also a shortage in nursing educators. How is all this affecting the healthcare field? Due to the shortage, many of our nurses are overworked. Because of the shortage, many nurses are working long hours under stressful conditions. Most hospitals and nursing facilities are understaffed, making a greater workload for the nurses that are there. Working longer hours under more stressful conditions can result in personal injury and fatigue. An unfortunate outcome is that patient quality care can suffer, resulting in a variety of preventable complications, including medication error, emergency room overcrowding, and more alarmingly, an increase in mortality rates, which is a very scary thought. In review, the three main reasons for our nursing shortage are simple: an aging population, aging workforce, and the shortages in the education field. These three things are going to cause a lot of problems for our society, such as hospital-related deaths. Do you think that the nursing shortage could affect you personally, even if you aren't in the healthcare field? Are you going to think about the nursing shortage the next time you're stuck waiting 30 minutes to see the doctor? I hope that this gave you a little insight onto the nursing shortage.